Across the globe, more than 400 million people survived COVID-19, but for some, there are long-term effects. Dr. Adnan Qureshi is a professor of clinical neurology at the University of Missouri School of Medicine. He became interested in particular complaints.
They cannot function at the same level. They're actually having difficulties in memory. They're having lapses in memory. They're having difficulty in mental processing of intellectual tasks.
Now, this team of University of Missouri researchers show a link between COVID-19 and an increased risk of dementia. The researchers found that patients hospitalized with pneumonia associated with COVID-19 may be at risk for dementia.
Mental processing is slow, is impaired, and they just can't function at the same level as they were able to do before the infection.
To get answers, Qureshi teamed up with researchers from the MU College of Engineering and the Institute for Data Science and Informatics to analyze data from more than 110 healthcare facilities in the U.S.
By looking at this kind of large-scale patients' data set, the data analytics is going to help us to connect the dots, to really look at what could be potential issues for some certain population of the patients. They might later develop dementia.
Out of the more than 10,000 patients with pneumonia associated with COVID-19, 312 people, or 3%, developed new onset dementia. This typically happened within 6 months of the pneumonia diagnosis.
For computational approach or artificial intelligence approach, we look at COVID-19, what could be the potential impact for patients, and then how we use AI methods to really quickly hash through the potential groups, subgroups, and the potential associations we have here. Then that's what the computer can do for us.
The results from the data analysis show that while developing dementia after pneumonia is rare, the odds are 30% higher among patients with pneumonia associated with COVID-19 compared to other pneumonias.
So that actually suggests that it's not just the pneumonia, there's something unique about COVID-19 or the SARS-CoV-2 infection.
He says further studies over time would provide more insights into why COVID-19 may increase dementia risk, and patients who are 70 years old and older have the greatest increased risk of dementia.
SARS-CoV-2 infection actually results in a lot of inflammation in the body, and these inflammatory markers actually are able to cross into the brain. And what we are seeing as a consequence of these excessive inflammatory markers circulating in the blood, entering the brain, and then subsequently causing brain damage. And the dementia is simply a consequence of this brain damage.
Meanwhile, the researchers hope this new information can be used to develop tailored treatments or screenings for the patients who are most at risk, an idea known as precision medicine.
Numbers and data are the new currency, right? And with those numbers, they are just publications, they are just some report. But by moving the numbers into the clinical practice, I think that's what we get the most excitement. Like to how to utilize the numbers we discover and apply that to the bedside. That's what we are looking for.